Welcome to the Vitality Vault Podcast, your one-stop shop for health and wellness. Join us as we dive deep into the latest medical trends, break down complex health topics, and empower you to live a more vibrant life.
Hi there. I'm Dr. Bacchus Morris, a triple board certified physician who specializes in internal medicine, obesity medicine, as well as anti-aging, regenerative, and aesthetic medicine.
Hi, I'm Dr. Gerald Morris, and I am a double board certified physician in internal medicine and obesity medicine with special interest in peptide therapeutics, which I got certified in.
Together, we're passionate about helping you achieve optimal health and longevity. From exercise, nutrition, we'll be bringing you the latest cutting edge in terms of weight loss and everything else in the wellness world to help you achieve a healthier you.
So our goal is to help you live your best life. So whether you're looking for weight loss strategies, longevity, just want to live a little bit better, and have these tips that you can apply to your daily life from day one, we are here to help. So come join us on this journey.
Join the doctors, voted top internist in Tucson 4 years running. So let's unlock your potential together. Welcome to the Vitality Vault Podcast with Dr. B and Dr. G.
Hey, what's up, fam? Welcome to our wrap-up video of the Vitality Vault. Season 1 is in the books.
Yeah, absolutely. Could you believe it? Season 1 episodes done. And season 2 is going to be coming.
Yes, so we're in production now. We are looking to release it sometime later on this year,
Yes.
most likely pre-fall. So look out for it. Look out for updates on when we're going to be releasing season 2 of the Vitality Vault. We've had so much fun doing this, Dr.
Yeah,
B.
we did.
Remember, the main goal behind this was to educate and to give you guys more information and empower you all on this health journey.
Yeah, so stay tuned for our next season. But right now, we're going to do a wrap up of the first season. So we're going to do an overview of the different episodes that we did during the first season, just so that we can refresh your memory. And it's always there for you to go back and look at as well.
So we got some notes, and we're going to give you salient points that we thought were really good and to highlight in each episode. And we're hoping to make this maybe a 2 or 3 parter in terms of the number of episodes we have. But we want to make sure that you guys, if you haven't seen some of the previous ones, you go back and watch. That way you can pick up the education that we were laying down.
Yes.
So episode 1 was understanding obesity. And as we know, obesity is a huge problem. Dr. B and I were both internists. Right. We both treat patients who have the disease of obesity, which is what it is. And one of the main things we found out in our research is that over 42% of US adults are affected by this disease. This is amazing. And with significant links to we have heart disease because of obesity, strokes, diabetes, you name it, a lot of chronic conditions are fueled by this disease.
Yeah, it definitely can cause a lot of chronic illnesses.
Yes.
And so that's why we want to address it, right? We also found that there were some disparities among races as well. There are higher rates in Black and Hispanic populations. And so we want to take that into consideration in our practice as well, too, and just let you know about that and the impact of it, of obesity with respect to race.
And we also know that's a lot because of certain foods we eat in certain minorities or certain ethnic classes are rich in carbohydrates and other not so body-friendly types of foods, which can cause or lead to the disease of obesity.
And maybe not having the greatest access to lifestyle changes, exercise, etc., in certain populations as well.
Even medications too.
Yes, absolutely.
And of course, we look at solutions that would require a community approach. We want people who have the disease of obesity not to feel isolated. We want you to be able to go out, request the information, talk to doctors or other healthcare providers who are fighting the good fight alongside. I know in our practice, we use people first language, which means when you come and see us and you're dealing with the disease of obesity, we don't say you, we say we, which is what we do. So we say, hey, you know what, how are we going to tackle this? What are we going to do? Because we're on the journey with you. We want to make sure that you're empowered and you have all the information necessary to make the right decisions to be successful.
Exactly. It's a partnership between us and our patients. Absolutely. And so, leading into episode 2, after that, we talked about weight loss strategies. We talked about diet, exercises, and all the different approaches and effective ones as well, because we know there's so many out there that you probably read about on the web, etc. Right? We talked about no single diet fits one. So we talked about the different types of diets. We talked about Mediterranean. Paleo diet.
Vegetarian and vegan is a good one. So, I mean, these are the ones that we kind of mentioned. And we do know that the Mediterranean diet has significance for heart disease reduction. So it's a good one to be on because it's chock full of like healthy vegetables. It's I think its primary focus is lower processed foods or no processed foods actually.
More whole
food approach. And that's good. And the most important thing is with regards to diets, let's think of it as a lifestyle change, right? And it's meant to help augment what you do by having this change, because most people hate the word diet, right? Because it has the word die in it. Who wants that? But having a lifestyle change is better, and it's good to rotate things. So if you want to do paleo for a couple of months, that's good. Then you switch off to maybe doing Mediterranean, that's good. But always do these with the guidance of a qualified healthcare provider who can let you know what's right for your situation and your health at the moment.
And along the line of lifestyle changes, we spoke about the importance of sleep and proper sleep, and that being able to tie in as well to help you with weight loss. We talked about stress management. I mean, who in this day and age doesn't have stress?
No one has stress. No, are you kidding me?
And how to manage it. Obviously, we can't avoid it, but how to manage and mitigate it. Social support and other groups out there that you can become part of that helps you to just become more mindful of what you're eating, what you're doing, your habits, etc.
Yeah, and also based on the notes we took, because we actually compiled a bunch of notes we want to give you guys, looking at medical innovations to help with weight loss, primarily the medications. We know they're huge, the GLP-1 class, all over the news, and more great data is coming out with regards to reduction in heart disease.
Right.
Obviously, weight is a big one, improving diabetes care. And now we're seeing data for sleep apnea. We're seeing data for PCOS. We're seeing data for
kidney preservation.
Exactly, preserving kidney function. And I want the stigma about using medications to treat the disease of obesity to go away. Because
those benefits are primarily for the GLP-1s that you were talking about, Dr. G, but there are other weight loss drugs as well too. We just know that those ones are the most popular ones, and we get a lot of questions about safety, but they do have pretty good safety data on them. So, but yes, we personalize for all of our patients or clients. We personalize what we do prescribe them, we want to help you along in that journey if that's something that you're struggling with.
And have the conversation. Have that conversation with your doctor or whoever your healthcare provider is. Ask them, you know what, I'm struggling with my weight. What can I do? And keep asking, keep searching. Never stick with one answer. You know, keep searching, because a lot of healthcare providers are not as knowledgeable as you would hope they would be with regards to dealing with weight issues. So I would say keep asking the question, find someone who can help you on this journey.
Absolutely. All right. And then following that, our episode 3 was about technology and weight loss. So we talked about wearables. We talked about different technology that's out there to help you in this journey.
Fitness trackers.
Absolutely. I'm wearing my Whoop today.
Yes, and I have my Oura Ring on. And I mean, and these have actually improved significantly in the data you can get from them. Like, I know, not that I need it, the Oura Ring now can track ovulation. And my data for that has been 0 ever since I got the ring. So I'm worried about that. You know, I don't know what's happening there. But it can actually help with sleep, especially sleep tracking. I know Dr. B with her Whoop, this is something that she uses in the gym, you know, and the data we get is actually quite robust, you know, in order to make changes for the future. Because remember, you can't improve what you don't change, what you don't track,
measure.
So if you don't track it and measure it, don't expect much improvement.
Yeah, like one of them I struggle with is my HRV, heart rate variability. So I'm always working on different ways to improve on that. And I wouldn't have known what that was if I wasn't wearing something to track it, right? So that's the importance of tracking these different measures. We spoke about coaching. We spoke about different nutrition coaching to help you, motivational coaching, someone to keep you accountable. Yes, you might know all the different things. You know, you listen to us, you hear us speak, but sometimes we need just that person to keep you accountable and to check in with you. Like, did you do this?
Mm-hmm.
You know, how are we going? How are we doing with respect to B and C? So that's really important too. Some of us need that little push as well.
And for coaching, nutrition coaching is good. We actually have that as part of our practice for our weight loss clients,
Mm-hmm.
where every month we have 2 coaching calls every 2 weeks,
Yes.
just to help clients navigate. It's a lecture series followed by a Q&A. So it's something that if your doc or your area has it, please look
Mm-hmm.
for it, because it does help to keep you accountable, and it removes some of that loneliness as you're going through this journey.
Absolutely. You have
Mhm.
someone in your corner.
Mhm.
Yep. And we spoke about new testing on the market, genetic-based testing that will help you, help us to figure out like what would be the best diet or
Mhm.
what would be the best type of exercise based on your genetics. So there are a few of these testings out there on the market,
Mhm.
and they're continuously working on making them better. So these are things that we also offer to help with your journey.
So weight loss is not a one size fits all. Basically, you understanding how your body processes certain nutritional calories or macros, that's
Mhm.
a good place to start when you're about to initiate into that weight loss journey. So it's important to seek that out, because personalized medicine is the wave of the future. Not being pigeonholed into a
Mhm.
box, but understanding my body is different from Dr. B's body, and from Mr. Jones's body and Mary's body. Okay, how my body processes calories might be different. There are things that I can do.
Absolutely. Absolutely. Yes. All right. Moving on to overview of episode 4. We did this one on joint health and inflammation. We did a series of inflammation.
Mhm.
So on the joint health, we talked about obviously joint health being important for your mobility and for your quality of life
Mhm.
as we age, right? As we move to different areas of our, in our lives.
Mhm.
And chronic inflammation can definitely have an impact on our joints, not just the bones, but the muscles, the soft tissues
Mhm.
around them. We talk about arthritis. We talk about people expecting arthritis to happen no matter what as you age, and that doesn't have to happen. We talked about decreasing exercise just decreasing inflammation through exercise, through diet,
Mhm.
through weight management if that's needed,
Mhm.
and other chronic medical problems that may be creating the inflammation. All of that is important in proper joint health, in decreasing inflammation overall.
Yes, because chronic inflammation is the harbinger of disease and death.
Mhm.
Remember, it's a fire that's burning in the joint. That's what inflammation is. The more we can suppress that fire or eliminate it, the longer you'll have those joints and they remain yours. The more we ignore it, then we're heading down the road of more invasive procedures that people like me have to do, which is either injections or replacement if it gets to that point.
Right. We spoke about diet. We spoke
Mhm.
about supplements.
Mhm.
Vegetables and whole grains are great to help with reducing inflammation. Supplements like omega-3s.
Omega-3s are awesome.
Mhm. And then we talked about the foods to avoid.
What might those be?
Sugar.
Sugar and hyper-processed foods. We want to avoid those
Yes.
at all costs. Even things like alcohol and other things to avoid, like smoking. Because alcohol and smoking
Yes.
are pro-inflammatory. Anything that's pro-inflammatory is not your joint's friend. Processed foods, highly pro-inflammatory. Carbohydrates or the high sugar foods, highly pro-inflammatory. So just do yourself a favor. If you're someone living in chronic pain, analyze your diet, analyze your lifestyle. And if you have to have that 2 donuts and a cup of coffee every morning, maybe let's have just one, or eventually none. Or if you have to have the sweet candy before you go to bed, a couple cookies and some milk, maybe none. And just do a protein-based meal, and then see overall a reduction in inflammation.
And if you do already suffer from some kind of joint injury, etc., that's preventing you from doing certain things, we talked about types of exercises. So low impact exercises that you could do. You don't need to be out there running. You don't need to be doing box jumps, but you need to be doing things that are, yeah, Dr. G loves box jumps. There's a whole story behind that. But you need to be doing low impact things that will not cause any more injury to that joint, but will help to strengthen the joint and the muscles around it. So different, just choosing your activities wisely. And we spoke about things like physical therapy, stretching. There are places that offer professional stretching.
Yes.
With a lot of science-backed evidence of it helping. So just different ways in which we can actually help those achy joints or muscles that are already, you have an injury or something there already, help improve the health of those.
And throwing in some good old-fashioned foods. We're from the Caribbean, so things like ginger is good. Turmeric is good. So check out episode 4 for more information on that.
Yes.
Now, episode 5, gut health and more information.
Right.
So we know the gut we call it the second brain because the gut has a plexus of nerve tissue, and it's literally one of the 2 ways that your body interacts with the world, either through your skin or through your GI tract.
Yeah, 80% of whatever enter your body actually comes from the gut. So it's really important what we put into our mouths, for sure. Yes. And we talked about the gut microbiome being the bacteria. We have healthy bacteria. We all have healthy bacteria in our body. That's what helps to break down some of the nutrients, etc. And we talked about the types of bacteria that is supposed to be there, and also the amount, having a balance and not having overgrowth of certain bacteria. That's when we say that we're having dysbiosis, which is, we need to then figure out what do we use or what do we eat or what supplements do we take to help to balance those a little better.
That's the local term is I think, leaky gut syndrome, which I'm sure many of you have heard of. And we're seeing more and more data now pointing to the fact that unhealthy gut microbiome is causing a lot of inflammation and disease processes to propagate, including the disease of obesity and including joint issues, including heart disease. So look up and you'll see more and more data pointing towards a healthy gut microbiome, helping with the improvement of a lot of chronic maladies that Dr. B and I treat on a daily basis.
Yes. And talking about leaky gut, so essentially you have more openings between these areas that are supposed to block certain things, because we do ingest a lot of toxins and other things that we really don't want in the body, whether it be pesticides and stuff that we can't really avoid right now because it's everywhere. So a leaky gut, these can enter your system easier and can lead to eventually chronic diseases. And we talked about autoimmune disease as a big one that can cause chronic illness, a whole harbinger of other things down the road. And so that's why it's important to, look at the health of your gut.
And one good thing to do, you want to get more fiber. Obviously, before you do any dietary change, like we said before, talk to your qualified healthcare provider. But what we advise our patients to do is get more fiber. Do a probiotic. And if you don't want to do a probiotic, do foods that feed your gut microbiome. Things like yogurt, kefir, all the fermented foods, all those are good for that gut microbiome, just to keep it healthy and keep it diverse. Because you don't want just one strain in there. You want to be diverse because that interplay helps to keep the gut lining strong.
Yes. And on the diversity part, just rotating your probiotics as well every 3 to 6 months, just changing up those strains that you're introducing into your system. Yes.
Now, number 6, episode 6 was all about cholesterol. So this is where we dove deep into maladies that patients that we deal with on a daily basis. And we talked about high cholesterol in this one. Silent but deadly. It is still, I think, the number 1 killer in the U.S.
Well,
is high cholesterol,
exactly, causing
heart disease
specifically,
so
and stroke.
So you want to be careful, and we are seeing more and more people in the younger and younger population coming up with high cholesterol, and that's primarily driven by diet, primarily driven by how we live. We're getting more sedentary. We live in an age where literally we don't have to walk to go anywhere anymore.
Right.
You can drive, and if you want something to eat, you don't have to go and forage. Guess what? You go on your app. And it gets into your house. You order it and it gets into your house. So we, in our jobs, we're sitting most of the time. So it's important to understand the risk factors, which include lifestyle. And now genetics does play a role.
Mhm.
So you do have those
Absolutely.
clients who have a genetic predisposition for heart disease or high cholesterol. However, what we're seeing more and more in the personalized medicine space or the functional medicine space is that even though you have the genes for something, it doesn't mean that it has to be your reality. Sorry.
Mhm.
What I'm saying is having the gene or the propensity for something is usually triggered by you living a certain lifestyle that induces those markers and those genes. So it's never doom and gloom. It's more like, okay, so I know this is my path or my potential path. What can I do to avoid it? Or reduce it significantly where it doesn't cause me health issues?
Right. So being aware of your family genetics for this, if you're high risk, is just, more reason for you to be super careful with your lifestyle habits. And you don't know if you have high cholesterol when you check it, so you have to have your labs
Get
done.
that blood work done.
Yep, absolutely. And the treatment, like Dr. G was saying, is multifaceted. So it's sticking to healthy diet, a Mediterranean diet, as we said, is probably the best one if you have high cholesterol or heart disease, to help with decreasing your chances of any further disease process. Of course, exercise, and it's a combination of aerobic and weight training, actually, once you can tolerate it. Again, going back to what you can tolerate. And of course, there are prescription medications. I'm sure we all know about statins. There's some newer ones now in the market, some injectables for those of you who can't tolerate statins.
PCSK9 inhibitors, that's what they are.
Absolutely.
Work really well, actually.
Yeah. And we always promote supplements if we can go the natural route first, if it's not something where we absolutely need to start a prescription medications. We've talked about omega-3s being good for cholesterol. Plant sterols are another one. Red yeast rice. We have berberine, which is great for not just cholesterol, blood sugars as well. And again, personalized to you, like what would be the best fit for you.
Then episode 7 was all about the blood pressure, hypertension, another common malady. It's part of that trifecta that we see in our practice: high cholesterol, high blood pressure, high blood sugar.
Absolutely.
All the not
it's a
so
metabolic
nice
syndrome.
Metabolic syndrome, basically.
Yeah.
So we talked about ways you could manage. Actually, the best thing to do is to get a physical, have your blood pressure checked, and then if it is elevated, the doc will tell you, hey, here's where you're at, and then you get your own cuff, learn how to use it. Start measuring it yourself so you see where you're at, especially if it's a family history.
Exactly.
If mom has it, dad has it, and look at other factors that could be pushing that blood pressure issue. And you want to be careful, because the longer you stay in that high blood pressure range without treatment or lifestyle modification, to be exact, right, to get things better, the more you run the risk of having things like heart attack, stroke, and kidney disease or kidney damage because of that poorly controlled blood pressure.
Absolutely. And we spoke about different ways in which we can help to manage blood pressure. Of course, again, going back to lifestyle changes and going back to certain supplements that you could use as well to help. Stress management is a big one, blood pressure. And in terms of diet, sodium intake is a big one. So you want to avoid all the prepackaged foods. They're usually full chock of sodium in there. And again, if you have a family history, you have to be just very, extra careful with this.
Read the food labels, guys, because that's where the actual sweet sauce is. Understanding what's on the label, the sodium content per serving, so that way you can say, okay, good, is this something good for me to have? I have high blood pressure. Maybe I shouldn't be eating this.
Absolutely. And then, of course, we spoke about medications. When we get to that point where, you've done your lifestyle changes, you supplement, or if you come in, your blood pressure at a serious level where we're thinking, if we don't get this down now, you could have a stroke sometime soon, then we prescribe certain medications. We spoke about first-line medications such as thiazide diuretics. We spoke about ACE inhibitors, where they actually relax the blood vessels. So the diuretics eliminate extra fluids.
Mhm.
And that's how it helps. There's some of them that helps with relaxing the blood vessels in the kidneys, in the heart. We talked about calcium channel blockers and beta blockers. That helps with heart rate and vessel relaxation as well too. And we spoke about, different side effects and what to look out for. So of course, if you're going to be prescribed medications, you need to have that talk with your doctor about, okay, what do I expect? What is to be expected? What side effects should I look out for? What concern should I call for, etc. And again, you need to monitor it. So you need to have your own blood pressure monitor at home if you're going to be treated by medications, so that you make sure that it gets into the normal range at a certain time, doesn't get too low. It's not out of control, it's not staying high. So absolutely taking matters into your own hand, when it comes to your health.
And we encourage everyone to, when you get put on a medication, have that question loaded to say, hey, when can I get off this? And most times you'll hear maybe never. But I would say always ask the question, because a lot of times high blood pressure is triggered by something else in your life. Like Dr. B said, stress. So doing stress management and meditation, diet, adjusting the amount of sodium you take in, weight, reducing body weight, all those things, making a considered effort to improve those other factors, which, let's be honest, we all have proper control over if we think really hard about it. You may be able to be the lucky one to get off of some of these medications.
Yeah.
So that was part 1 of our recap. We have part 2 coming up soon. Thank you so much, guys, for enjoying and sending in your questions to the Vitality Vault.
Yes.
We will get you back soon with part 2 of our recap.
All right. See you guys later.
Take care.